Good morning. This is Dr. McDaniel at GYN Corner. I'm a board-certified obstetrician gynecologist in New York City, Midtown Manhattan, and I'm bringing to you all things health-related for women. I'm at the horse farm today with my daughters. Joy's the one practicing right now. She's cantering and jumping. Jill already did her lesson. We've been coming here to Baymar Farms for a long time now. Jill is 13 and she came here when she was 5. So we've been coming here for 8 years. It's a nice farm. Joy's been riding since she was 3 years old, and Joy is 9 now. She's doing her lesson right now. They have their old teacher back. They had this teacher, John, from when Jill was 5 up to when Jill was 11, and then he left, and they got a new teacher, which they liked a lot. She was great, but apparently she's leaving to go back to school. Started late today. I was doing a lot of stuff once we got here today, so I started kind of late. Unfortunately, we're on a time schedule today, so it's looking like this is going to be a brief recap. I wanted to do I'm going to talk about ASHERMAN'S syndrome today. Was going to be a recap of the introduction and presentation, and then diagnosis, but I think I'll see how much I can get in before I have to leave today, so sorry for the short presentation. Yesterday it was 18 minutes, so today it'll probably be like 7. We'll see. I'll show around the farm a bit while I'm talking. So ASHERMAN'S syndrome is a condition where scar tissue has occurred inside the uterine cavity and caused a disruption of the normal function of the uterine cavity or the uterus, which is to have normal monthly menstrual cycles and, if one wants, to get pregnant. That normal function is compromised because of scar tissue, which we call adhesive bands, adhesion disease, or snakeae. So the scar tissue sticks the two inside walls of the uterus together. So yesterday I stated, if you think of the uterus as a mitten, the inside of the mitten is scarred up, and then they get stuck together, or almost like a grilled cheese sandwich, where the walls of the uterus is the bread, and then the cheese is the scar tissue. Now it can be completely solid, like a slice of cheese, or it can be pockmarked like a slice of Swiss cheese. And everywhere you have the holes in the Swiss cheese is normal lining of the uterus, but other than where the holes are, the walls of the uterus, or the layers of the bread, are stuck together, and it prevents the uterine lining from building up normally to have a menstrual cycle. The tissue or the blood that builds up to cause a menstrual cycle does not normally occur because that functional layer of the endometrium, which is the lining of the uterus, the endometrium, it does not build up. And then obviously, because it does not build up, it does not come out either. So there isn't a normal menstrual cycle. So with ASHERMAN'S syndrome, it will predominantly manifest as lack of menstrual cycles, or spotty menstrual cycles, or just pain, cramping, instead of the menstrual cycle, or severe pain or cramping with the spotty menstrual cycles. And if someone's trying to get pregnant, it will usually manifest as infertility or frequent miscarries, because perhaps she's able to get pregnant in the tiny little spot of normal uterine tissue that's left there, the little pockmark from the Swiss cheese, but then the uterus can't normally expand, the pregnancy can't normally expand, and then she miscarries. So ASHERMAN'S syndrome is a rare occurrence. It occurs approximately 1.5% of infertility patients have ASHERMAN'S syndrome, and the degree of occurrence is predominantly unknown, and it can span from potentially the 1% up to even 40% of women after certain disease manifestations and surgeries and procedures. So the most common scenario that will cause that scar tissue is an infection with chlamydia or gonorrhea, because they're highly inflammatory infections that ascend on their own, can ascend into the uterus and out through the fallopian tubes, cause a pelvic inflammatory disease, PID. They can cause a pus-filled infection in the uterus, a purulent or suppurative intrauterine infection. It's called a pyometra, or an acute endometritis. And the body reacts or responds to that infectious inflammatory environment by trying to fight it and trying to heal, and it heals the scar tissue. Another way that one can produce or can get ASHERMAN'S syndrome is from an infection or inflammation due to tuberculosis or schistosomiasis, which is an amoebic disease. Those are most commonly in underdeveloped worlds. Surgery is second tier potential here in the States and other modern countries. Surgery after a miscarriage, or if there's an incomplete miscarriage where there's a lot of bleeding because there's tissue still stuck on the walls of the uterus, we do a curettage or scraping, and that scraping for some patients may occur a little too vigorously, and remove that basal layer of the endometrial lining, which is a supporting layer that provides the blood flow and nutrient and everything to the overlying functional layer that forms the menstrual cycle. So after a curettage or DNC, or especially if someone has a scraping, either from a miscarriage or from an abortion, a termination, if she gets an infection afterwards, either she has intercourse while she's still bleeding after a procedure like that, that will push bloody bacteria into the uterus. It's a freshly operated or manipulated lining that can cause it. And even without having a surgery, one can get an infection in the uterus from having intercourse during the menstrual cycle, or douching too close after the menstrual cycle. Surgeries to remove fibroids is a big risk factor, potentially, especially if the fibroids traverse the entire wall of the uterus. So they pooch into the cavity of the uterus, so they're submucosal, and they go all the way through the wall of the uterus, intramural, and stick out from the skin underlying the uterus, the subserosal. So if they're plucked out or removed, they enter the cavity of the uterus. They're going to disrupt and potentially remove that basal layer and cause scarring. So those are some of the biggest factors which go into setting someone up to get ASHERMAN'S syndrome, which is a removal or destruction of that basal layer of the uterus. And then through healing, natural way the body heals, it's going to cause scar tissue, and that scar tissue or adhesive bands, synechia, they stick the two walls of the uterus together. The signs will be either a lack of menstrual cycles or very little menstrual cycles, but with the normal menstrual symptoms and either normal pain cramping or severe pain or cramping. And then I guess a secondary sign would be infertility, and then thirdly it would be frequent multiple miscarriages. The way we diagnose Asherman's syndrome is through history. Index of suspicion is what that's called, and then through an ultrasound to see if there's potentially a mass or growth that's blocking or preventing the cycles or causing the miscarriages. And then usually the second test will be a special x-ray where fluid dye, or what we call contrast medium, is injected into the uterus. It's very opaque, so on an x-ray it shows up bright, and then we can see if that fluid flows normally through the uterus and out through the fallopian tubes, or if it shows blockages or pock marks where the cavity is not normally open, it's closed. That test is called an HSG, or a hysterosalpingogram. And then ultimately, if the hysterosalpingogram is abnormal, it shows blockage or an abnormal or an uneven or an irregular pattern of flow in the uterus, which will indicate scar tissue or lack of a normal opening or cavity in the uterus. Then a hysteroscopy, so day surgery is performed. The hysteroscope is basically just a camera, and we put the camera into the uterus to visualize the uterus. Some people will do the hysteroscopy just by itself. Most people will do a hysteroscopy and a laparoscopy, which is putting the camera into the belly, look so that you can look into the pelvis, make sure there's nothing on the outside of the pelvis or potentially scar tissue that's pulling the uterus, weird angulations or weird deformations. And then the camera inside the uterus to visualize the scar tissue. And then obviously the scar tissue has to be broken up. So there are lots of ways to cut or to open the uterus. You can do it with heat, laser, burning, with bipolar or monopolar it's called. Most people will just use the equivalent of a scalpel or scissors. So we call that, because there isn't any heat associated with it, we call that cold knife. So through the camera we have tiny little scissors. They're about the size of your thumbnail, anywhere from your pinky nail to your thumbnail. If they're normally cut, they're not long. And then those scissors are used to cut midline to break up the stuck walls, and then the camera on the outside is used to make sure that the scissors aren't cutting too deep and actually going through the uterus or getting too close to the uterus. You can see that from the light inside. So I'm going to stop right there with the signs and symptoms, the risk factors, and the diagnosis of Asherman's syndrome, a rare but what can be potentially devastating syndrome or occurrence or disease for women with fertility problems. Sorry for the short presentation today. I'm on a time constraint. Next presentation I'll be back with the conclusion, do a brief recap, and then how we actually treat. So that's the diagnosis, that's the treatment, and then the follow-up to the treatment. Thank you for joining me here at GYN Corner. Please click the like button and click the follow and subscribe button so you can get heads up on when and what I'm presenting. And please place comments with questions, suggestions for presentations. I'd love some suggestions. And also check out our YouTube channel. The YouTube channel is called GYN Corner, and click the like and follow buttons there. I don't have many people watching me on YouTube. Don't have many people watching me on Facebook either. I think we're around 100 or so on Facebook. I think it's like 110 or something like that last I checked. We're only around, I think, 13. I checked yesterday when I was on the YouTube. We're around 13 on YouTube, so let's get the YouTube numbers up and away. And please check out the podcast. We're on 8 different platforms for the podcast. The most popular, I suppose, is the Apple iTunes. And then please place a review. Let others know that you watch GYN Corner. It's a cool thing to do. and let others know what you like about GYN Corner. Thanks again for watching, and have a great rest of your weekend. Bye!